Joining me now is Dr. Tolu Olufunlayo, the Chairman, Association of Public Health Physicians of Nigeria. Dr. Olufunlayo, it's good to have you join me right now. Now, make us understand basically, when we hear of community transmission or community infection, break it down for us. What is the difference, or what does it mean differently from anyone being infected?
Okay, thank you very much for having me on this morning. When we talk about community transmission, we are looking at a different phase of the infection. First of all, we had the infection imported from other countries from where it had started from. And then you have infection in the contacts of those people, which we sometimes refer to as local transmission. But then it gets to a point where there is a rapid spread within the community, and it then becomes difficult to trace some of the ways in which those people got infected. It's at that point we say we have community transmission. Okay. And that's where we are right now.
All right. Now, there has been a lockdown in Lagos and Abuja, and as well as Ogun State for some time now. And the numbers of infection is increasing more, even in the states where there's this lockdown. Make us understand, what could be the reason behind this spike in the number of infection in Lagos and Abuja?
Well, there are quite a number of reasons for that. First of all, our capacity for testing has just been increased and is still being increased. Almost on a daily basis, we have new labs being commissioned. Also in Lagos and Abuja, we have begun what we call community testing, in which we are actively going out to look for people who are suspected cases of COVID-19, and they are getting tested. So it's beginning to show a bit more of the true picture of what is going on in the country. But then thirdly, you see, the disease is a progression, really. So like I said, we're already in community transmission now. So it's spreading more quickly than, when it first came in and there were just a few contacts. So these are some of the reasons why it's looking this way now.
All right. There has been fears that there could be more number of people who are infected but are not or have not been identified than those we report on the news every day. Do you, by any means, have that kind of inkling or a hunch that we could have more number of people out there that are infected with COVID-19?
Definitely. When you look at a disease or an infection, you have to understand that infection to be able to identify what is going on. Now, though COVID-19 is a novel disease, we are beginning to understand some things about it. And one of the things is that quite a number of cases may be asymptomatic. That means they don't show any symptoms at all, even though they are infected, and they can transmit the infection to other people. In addition, for COVID-19, people sometimes are most infected just before they start showing symptoms. And we call that pre-symptomatic phase. So you see the person's looking normal, you are talking with him, and then in 2 days' time, he comes down with the symptoms, but he has already infected somebody. So there are definitely quite a number of people who are not showing symptoms but have the disease. And may I add that unlike in the European countries and in the US, where we're seeing a large proportion of people with severe or critical manifestations of COVID-19, in Nigeria, the picture is not yet like that. So we assume that there are quite a number of people, for a high proportion of people, who are actually asymptomatic or very mild, mimicking the common cold or flu. And when you consider the health-seeking behavior of us in Nigeria, many of us don't like to report to health facilities anyway. And that's one of the reasons why active case surveillance has been instituted.
All right. WHO has warned earlier that the numbers of COVID-19 or the impact and the devastation could increase in sub-Saharan African countries because of the weak health system that they have. What should Nigeria be looking at right now, considering the fact that we have always been complaining of how weak our health system has been?
Well, this is just a wake-up call to us again that we must fix our own. We can't continue to look out the window. In the past, I mean, people had the opportunity to run away to other countries to fix their health problems, but now we have to remain in country. So we must make concerted efforts to ensure that we fix what we have. And the Association of Public Health Physicians at the national level have just released a technical, paper on health responsiveness to COVID-19. And it's very comprehensive, detailing several different aspects that we must look at if we really are serious about tackling this pandemic in Nigeria.
All right. Dr. Tolu Olufunlayo, thank you so much for talking to us on TVC Breakfast.